Hi, we're gonna talk about the importance of the antenatal care. To begin, pregnancy is the state of carrying a developed embryo of fetus in the womb. It takes 4 weeks and represents one of the greatest unfoldment moments for most women. However, during this period, both the woman and her child face various health risks. For this reason, it is important that all pregnancy should be monitored by skilled care providers. Based on WHO data, in 2016, with the start of the Sustainable Development Goals (SDGs) era, pregnancy-related preventable morbidity and mortality remains at very high rate, and that is a fact that cannot continue happening considering the resources, advances, and information available today. Nowadays, every pregnant woman and newborn can receive quality and throughout the pregnancy, childbirth, and the postnatal period. With the management of reproductive health care, antenatal care (ANC) provides a platform for important healthcare functions, including health promotion, screening and diagnosis, and disease prevention. It has been established that by implementing timely and appropriate evidence-based practice, ANC can save lives. This is one of the many reasons why ANC is an important issue. The recommendations that are proven during this period are key not only to save lives, but to improving lives, healthcare utilization and quality of care. Women's positive experience during ANC and childbirth can create the foundation for healthy motherhood. For all the advances mentioned above, this video aims to focus the different cares and attention a woman should receive during her pregnancy, including the cares of her diet, the substance that she should avoid exposing herself, the regular checks and every antenatal appointment, the exams that must be done, and finally, the possible consequence of not caring and educate antenatal care.
Antenatal care is defined as the care that the woman receives from healthcare professionals during her pregnancy. It is carried out through appointments with a midwife or sometimes with a doctor, an obstetrician, who will make sure that the woman and her baby are well and answer any questions that she has. If the woman is expecting her first child, she is likely had up to 10 appointments. If she has had a baby before, she should have around 7 appointments. In certain circumstances, for example, if she has or developed a medical condition, she might have more appointments. The aim is to check the progress in women and their babies and provide clear information and explanation about their care. After knowing this, we can divide the schedule in early and later pregnancy appointments. In early pregnancy, up until 20 to 24 weeks, antenatal appointments will take longer than those in mid-pregnancy. This is because the doctor will need time to assess the mother and her baby, discuss the care, and give all the information about it. At each appointment, the woman has the chance to ask questions and discuss any concern or issues. In later pregnancy, from 20 to 24 weeks, antenatal appointments will become more frequent. If the pregnancy is uncomplicated and the woman as well, it may not be seen as often. To start with the appointments of this process, there is the first contact with the doctor. This appointment is when the woman tells a doctor that she is pregnant and they should give the information about folic acid and vitamin D supplements, nutrition, diet and food hygiene, lifestyle factors that may affect her health or the health of the baby, such as smoking, drinking, and recreational drug use, and antenatal screening tests. It is important to tell the doctor if there was any complication or infection in a previous pregnancy or delivery, such as preeclampsia or premature birth. You are being treated for a chronic disease, such as diabetes or high blood pressure. You or anyone in the family has previously had a baby with an abnormality, such as spina bifida, or there is a family history of an inherited disease, such as sickle cell or cystic fibrosis. Booking appointment 8 to 12 weeks. The doctor should give information about how the baby developed during pregnancy, nutrition and diet, exercise and pelvic floor exercise, antenatal screening test, breastfeeding including workshops, antenatal education, maternity benefits, planning the labor, and option for where have the baby. The doctor should give a plan of care, see if it needs additional care or support, plan the care that each one will get throughout pregnancy, identify any potential risks associated with any work that it can do, measure height and weight and calculate body mass index. In weight and height, most women put on between 10 and 12.5 kilograms in pregnancy, most of it after the 20th week. Much of the extra weight is due to the baby growing, but the woman's body will have to be storing fat ready to make breast milk after the birth. Eating sensibly and taking regular exercise can help. The doctor should also measure blood pressure and test urine for protein. These are two tests that will be checked at every antenatal appointment. Urine is checked for many things, including protein or albumin. If these are in the urine, it might mean that there is an infection that needs to be treated. It may also be a sign of preeclampsia. A rise in blood pressure later in pregnancy could be a sign of preeclampsia too. The doctor can offer screening tests, where there include several blood tests and others. Some are offered to all women, and some are only offered if it is a tooth that she is in risk of a particular infection or inherited condition. One of these is blood group and rhesus factor. It is important to know if the woman is rhesus negative or positive. Some women are rhesus negative. This is usually not a worry for a first pregnancy, but it may affect the next child. People who are rhesus positive have a substance known as D antigen on the surface of the red blood cells. Rhesus negative people do not. A woman who is rhesus negative can carry a baby who is rhesus positive if the baby's father is rhesus positive. During pregnancy or birth, small amounts of the baby blood can enter the mother's bloodstream. This can cause the mother to produce antibodies. This usually doesn't affect the existing pregnancy, but the women become sensitized. This means that if you get pregnant with another rhesus positive baby, the immune response will be quicker and much greater. The antibodies produced by the mother can cross the placenta and attack to the D antigen on her baby red blood cells. This can be harmful to the baby, as it may result in a condition called hemolytic disease of the newborn, which can lead to anemia and jaundice. The other tests are used to detect other diseases, such as syphilis, hepatitis B, HIV, cystic fibrosis, herpes, among others, which can seriously affect the baby. Most hospitals will offer women at least 2 ultrasound scans during their pregnancy. The first is usually around 8 to 14 weeks and is sometimes called the Dayton scan because it can help to determine when the baby is due. 16 weeks appointment. The doctor should give information about the second ultrasound scan. It should too review, discuss, and record the results of any screening test, measure blood pressure, and test urine for protein, and consider an iron supplement if there are anemia. The second scan usually takes place between 18 and 20 weeks and is called the anomaly scan because it checks for structural abnormalities. 25 weeks appointment. The doctor should measure blood pressure and test urine for protein and check the size of the uterus. This is a way for check baby's growth. During this, the doctor will measure the distance from the top of the uterus to the pubic bone. 28 weeks appointment. The doctor should use a tape to measure the size of the uterus, measure blood pressure and test urine for protein, offer more screening tests, and offer first anti-D treatment if the woman is rhesus negative. Anti-D injection prevent rhesus negative women producing antibodies against the baby and reduce the risk of a rhesus negative woman becoming sensitized. Rhesus negative mothers who are not sensitized are offered anti-D injections at 28 and 34 weeks as well as after the birth of their baby. This is quite safe for both the mother and her baby. 31 weeks appointment. The doctor should review, discuss, and record the results of any screening test from the last appointment, use a tape to measure the size of uterus, and measure blood pressure and test urine for protein. 34 weeks appointment. The doctor should give information about preparing for labor and birth, including how to recognize active labor, ways to coping with pain in labor, and the birth plan. It should review, discuss, and record the results of any screening test for the last appointment, use a tape to measure the size of uterus, measure blood pressure and test urine for protein, and offer second anti-D treatment if the woman is rhesus negative. 36 weeks appointment. The doctor should give information about feeding the baby, caring of the newborn baby, vitamin K and screening tests for the newborn baby, the women's health after the baby is born, and the baby blues and postnatal depression. The doctor should use a tape to measure the size of uterus, check the position of the baby, and measure blood pressure and test urine for protein. 38 weeks and 40 weeks. The doctor will discuss the options and choices about what happens if the pregnancy lasts longer than 41 weeks. It should too use a tape to measure the size of uterus and measure blood pressure and test urine for protein. And finally, in 41-week appointment, the doctor should use a tape to measure the size of uterus, measure blood pressure and test urine for protein, offer a membrane sweep, and discuss the options and choices for induction of labor.
A healthy diet and lifestyle can help a woman to keep well during pregnancy and give the baby the best possible start to life. Deficient nutritional requirements during the critical phases of life, such as intrauterine life and the prenatal period, can give rise to serious alteration of the central nervous system and other organs and have very seriously and definite repercussions in adult life. A special and stricter diet is not necessary, but it is important to eat a variety of different foods every day to get the right balance of nutrients for both a woman and her baby. The pregnant woman should also avoid certain foods. To take a balanced diet is enough to observe the eating well plate. Fruit and vegetables. As well as vitamins and minerals, fruit and vegetables provide fiber, which helps digestion and prevents constipation. Meat, fish, egg, beans, and other non-dairy sources of protein. These foods are all good sources of nutrients. Its consumption and moderate. Foods and drinks that are high in fat and or sugar. It should only eat a small amount of this group. Sugar contains calories without providing any other nutrients that the body needs. Milk and dairy foods. This group is important because they contain calcium and other nutrients that the baby needs. Bread, rice, potato, pasta, and other starchy foods. Carbohydrates are satisfying without containing too many calories and are an important source of vitamins or fiber. Foods to avoid. There are some foods that the pregnancy woman should not eat because they may cause ill or it can harm the baby. It should avoid some types of cheese, mold ripenings of cheese like brie, camemberts, and others with similar rind. Soft blue vein cheese, like Danish blue. They are made with mold and they can contain Listeria, a type of bacteria that can harm the unborn baby. Raw partially cooked eggs. This prevents the risk of salmonella food poisoning. Raw or undercooked meat. Liver products. They may contain a lot of vitamins A that can harm the baby. Supplements contain vitamin A. Some types of fish, like shark, marlin, and sawfish, and limit the amount of tuna to no more than 2 tuna start a week. This type of fish contain high levels of mercury, which can damage the baby. Peanuts, unpasteurized milk. Caffeine. High levels of caffeine can result in babies having a low birth weight, which can increase the risk of health problems in later life. Too much can also cause mirage. For this, it is needed limit the quantity no more than 200 milligrams a day. But habits are something that should also be taken into consideration during this stage of life. Smoking. Every cigarette can directly damage the baby. In fact, consuming cigarettes during pregnancy is considered the first cause of health effects on the baby. Cigarettes restrict the essential oxygen supply to the baby, so their tiny hearts has to beat harder every time that her mother smokes. Cigarettes contain over 4,000 chemicals which the baby is exposed. Severe consequences of this habit may be premature births with low weight and unhealthy that have a higher risk of short desires and a higher rate of infanticide mortality. Pregnant women who smoke are more likely to suffer a miscarriage or suffer complications during childbirth. All those disorders can cause profuse bleeding, shock, and even the death of both the mother and the baby. Besides, secondhand smoke can cause low birth weight too and also cause death. Infants and parents who smoke are more likely to be admitted to hospital for bronchitis and pneumonia during the first years of life. Alcohol. Consuming alcohol can reach the baby through the placenta. Too much exposure can seriously affect the baby's development. Because of this risk, pregnant women or women trying to conceive should avoid drinking alcohol. Additional advice for the National Institute for Health and Clinical Excellence advises women to avoid alcohol in the first 3 months in particular, because of this increased risk of miscarriage. If the pregnancy woman drinks heavily, a particular group of problems could develop that are known as fetal alcohol syndrome. Children with this syndrome have restricted growth, facial abnormalities, learning and behavioral disorders, pills, medicine, and other drugs. Some medicine, including some common pillars, can harm babies' health but save our life. For example, medication to treat long-term conditions such as asthma, thyroid disease, diabetes, and epilepsy. Medicine and treatments that are usually safe include paracetamol, most antibiotics, dental treatment, including local anesthetics, some immunization, and nicotine replacement therapy. X-ray. X-ray should be avoided in pregnancy if it's possible. Work hazards. If the pregnancy woman works with chemical, lead or X-ray, or in a job with a lot of living, can risk her health and the baby's health. In conclusion, having a healthy life, good habits, and avoid several activities that can affect the baby, in addition to regular consultation with the doctor, represent an opportunity to have a healthy baby. Therefore, it's necessary to have an adequate prenatal control with reduced consequences that can be lethal, some of which could be simply due to the harmful effects that stress has on the people who are subject to it. Any deficiency is the trying process will be reflected into the birth and subsequent life of the baby. Taking this into account, It is vital to provide the mother with all the necessary resources and the provided environment for the child grow and develop during the gestation, and be fully aware of the risk that can be generated by not carrying out this prenatal care.